there, this is Dr. Evan Osar of Integrative Movement Insider. Welcome to part 2 of this video series on Psoas, syndromes, and solutions. Recall that in video number 1, if you missed that, make sure you watch that before that because this video feeds off the information from that video. Recall that in video number 1, we discussed the functional anatomy of the psoas, and the biggest myth surrounding psoas is that the psoas contributes to an anterior pelvic tilt. And we saw that the attachments of the psoas don't attach in a manner that allows it to, or enables it to, contribute to an anterior pelvic tilt. And in fact, the psoas attaches in a place in the pelvis that actually would make it be a posterior pelvic tilter. So we talked about the functional role, or the functional anatomy of the psoas, and that the psoas is primarily a lumbar spine stabilizer. It stabilizes that thoracolumbar junction, or where that thorax becomes a lumbar spine. It stabilizes the pelvis, and it helps to stabilize the femoral head within the acetabulum. It's actually a very inefficient hip flexor. The other hip flexors, like rectus femoris, sartorius, tensor fasciae lateral, are much more efficient hip flexors. So what we want to do in improving the function of the psoas, and as we talked about in the last video, most of the patients and clients that I see with hip dysfunction and low back dysfunction have an inhibited psoas, a dysfunctional psoas, and often it gets blamed for a lot of the issues around the low back and or hip. So we want to train its function in improving stabilization of the lumbar spine, pelvis, and centrating that femoral head within the acetabulum. One of our go-to patterns that we start out with the clients is the happy baby position. We love this position because it trains those functional or those foundational ABCs: alignment, breathing, and control. In the last video series about the core, we discussed breathing, so we're not going to go into that today. Today I'm going to focus on activating the psoas in its role of helping to stabilize the lumbar spine and the hip. The most important concept is we want to align that thorax over top the pelvis, maintain that pelvis in a neutral or slight anterior pelvic tilt, maintain that lumbar lordosis. The more optimal alignment is, the more optimal we can activate the psoas. The more optimal we'll be able to breathe, the more optimal we'll be able to coordinate the deep myofascial system like the psoas, transverse abdominis, pelvic floor, multifidi, with the superficial myofascial system, so those anterior and posterior oblique chains, the anterior flexor chains, and muscles like that. So we're going to go into the happy baby position. I'm going to talk about the alignment and talk about how we cue our clients to tap into their psoas muscle. So first thing we have our clients do is lie down on the table, feet about shoulder width apart. We want to position them as neutral as we can get them. If you want to do myofascial release or need to do myofascial release to help them get into a more optimal alignment, do that first. Next, we want to make sure that we position our client as optimally as possible. So a lot of our clients will need a towel behind their head to keep their head in better alignment and their neck in a slight cervical lordosis. The thorax should be positioned so it lines up with the pelvis. The pelvis should be in a slight anterior pelvic tilt with a slight lumbar lordosis. So I should not be trying to flatten my back down to the table, as that's a non-optimal lumbar spine position, and it will inhibit the ability of the psoas to stabilize the spine. First thing I want to do is take a couple deep diaphragmatic breaths into my ribcage, so that three-dimensional expansion. I want to relax my hips, relax my glutes, relax my erectors, relax my abdominals. Breathing in through the nose, not forcing it. Breathing out easily, in through the nose, out through the mouth. Now I give my client a cue to think of their psoas from the front of their spine to the front of their hip, and think of a wire connecting these 2 points. That's how they should be activating and lifting their leg up off the wall. So think of a wire connection and just gently float that leg up off the wall by that wire. There should be no change in my alignment. The first leg usually isn't too challenging. It's really when the second leg comes off. So again, that wire connection from the front of their spine to the front of their hip. They should bring the second leg up off the wall. And again, no change in their alignment, no change in their ability to breathe, no change in their alignment or the ability to have a conversation as their legs are elevated. Their face should not be turning flush or red. They should be able to still breathe three-dimensionally, maybe not as deeply, but still maintain three-dimensional breath. So now I'm going to have the client slowly lower one leg
down to the wall, tap the wall, come back up off the wall, stabilize. Exhale and inhale as I bring my leg back up. Exhale, easy, light, inhale to bring it back up. I'm still thinking about that wire connection to stabilize that femoral head in the acetabulum, as well as maintain my lumbar spine, my thorax over top of my pelvis through this exercise progression. And then have my client slowly relax, and again, same thing. There should be no change in the alignments once they relax. It should just be more active when they're engaged, their core, and lifting their legs, and less engaged when it's not. There's not this excessive flexion of the lumbar spine or hyperextension or change in their shoulders and or neck position. They should be able to maintain that thoracolpelvic cylinder, maintain the neutral curves throughout the pattern, and be able to lift and lower their legs with no change in their alignment, no change in their ability to breathe through the pattern. And that's really key to improving function of the psoas in its role as lumbar spine stabilizers, pelvic stabilizer, and femoral head stabilization within the acetabulum. In the next video, I'm going to show you how to take this pattern, take this action and function of the psoas into the upright position. Because again, this supine happy baby position is a great position to retrain the alignment, breathing, and control that individual needs. Now we need to teach it in the upright position. We'll go into that in the next video. This is Dr. Osar. Hope the video served you. We'll see you in video number 3, coming soon to your mailbox. Take care.